Welcome, everyone, to the Learning and Teaching Systemic Therapy podcast, the official Society for the Teaching of Marriage and Family Therapy, STMFC in short, podcast. I'm your host, Dr. Sofia Georgiadou. I created STMFC and this podcast as an antidote to the isolation I experienced as an early career academic. I also created STMFT and this podcast as a space to allow myself and my colleagues to share resources and bridge the way we do systemic therapy with the way we teach systemic therapy in our classrooms. Today, I have an amazing discussion lined up for you. Our discussion features questions I sourced from a PhD in MFT student and an experienced MFT professor who's navigated academia for several years now and is here to share her insights. Here with us today, we have Dr. Ashley Hicks. Dr. Hicks is a licensed marriage and family therapist, AMFC approved supervisor, researcher, consultant, speaker, and teacher. She's a clinical associate professor and director of the Ohio State University Couple and Family Therapy Clinic in Columbus, Ohio. Ashley is the founder of Our Lineage, Our Legacy LLC, and she offers trainings and presentations at the local, state, and national level to mental health providers, healthcare providers, clergy, community, and government groups to address mental health concerns such as disordered eating, anti-Black racism, race-based stress, trauma-informed, and focused care. Ashley has worked in several clinical settings with diverse populations, including racial and ethnic minorities, LGBTQ+ populations, homeless, and those experiencing poverty. Her clinical practice and research focus primarily on the needs Black individuals and families, including and those struggling with body image and eating concerns. Welcome, Dr. Hicks.
Thank you so much for having me. I'm excited to be here.
Awesome. I am so excited to have you on as well. Our PhD in MFT student guest we have with us today is Danielle Barcelo. She's a PhD candidate at National University, a fully online CMFT accredited program where she's getting her PhD in marriage and family therapy with a specialization in children and adolescents. Danielle is completing her dissertation on high conflict, post-divorce, or separated co-parents and their impact on children, adolescents, co-parents, and other systems. Danielle is an LMFT in Colorado, where she received her master's in marriage and family therapy, as well as 2 postmaster certificates, one in counseling children and adolescents that prepares you to become a play therapist, and another in depth psychotherapy. Danielle is also an AMFC approved supervisor candidate. She's a Latinx group practice owner, therapist, and supervisor in Denver, Colorado, where she was born and raised. Danielle identifies as a Hispanic, Mexican, American, Chicana, and Native American female. Danielle has over 10 years in the field, working primarily with underserved populations. She's continuing to grow her practice and has 15 therapists in her practice, 2 supervisors, an office manager, and a health and wellness coach. Wow, that's a thriving practice. Welcome, Danielle.
Thank you so much. It's an honor to be here with both of you.
Yeah, fantastic. All right. We'll be exploring questions that have been pre-sourced from Danielle. And I will be facilitating the conversation by sharing these questions. And I'm excited to hear Danielle's perspectives and also wisdom by Dr. Hicks. So without further ado, let's dive into our first question. Today, we're talking about decolonization. This is part 2. We tackled this on a previous episode of the podcast. I would love to know, Dr. Hicks, how do you personally decolonize MFT teaching in your own teaching practices? And what are some examples on how you do that?
Yeah, that's a great question. So I think of decolonization as this process of undoing and unlearning. And I'll talk a little bit about that in a bit. But really, it's this idea of how can we challenge, unsettle, disrupt the dominant social structures and dynamics that essentially say we don't have a right to self-determination. We need to engage in particular forms of healing that look a particular kind of way, and we need to learn in particular ways, modalities, that there's certain knowledge comes from a certain place, it looks a certain way, and that's the way that we have to go about the work that we do. And so when I'm thinking about decolonization in my teaching practice, I'm really thinking about trying to explore epistemology. So how do we know what we know? And what are the sources of that? And then also thinking about how can we unlearn the things that we previously learned that may not serve us anymore, that may be based on these dominant narratives. So that looks a lot like working with students. My goal when working with students is to help them develop a sense of critical consciousness. This comes from the work of Pablo Freire and like critical pedagogy, but like how can we help you be critical thinkers? How can we help you examine where your knowledge is coming from, what it's telling you, where it was sourced from? How can we bring in multiple perspectives? And then how do we work to really sit and potentially uncover the biases that might inform how we go about learning information in terms of therapy and like what practices are best? And then how do we, once we uncover some of those biases, are we willing to do the work to unlearn those biases so that we can think about, okay, I'm biased in this way for these recent reasons. I've been socialized in this particular context. Now that I have awareness of that, how do I develop knowledge and skills to help me maybe practice in a different way or think about things in a different way? So sometimes
Mm.
that's simply bringing new perspectives into the classroom so folks can hear from other people about their understandings of healing, health, and well being. Sometimes that's doing some examination of like our foundational models and where they came from and who wrote them and why and when. And then sometimes it's simply trying to help folks consider that there are other possibilities that exist outside of like our Western sort of Eurocentric paradigm.
I have so many questions, but I'm wondering what Danielle is thinking about this. And also, Danielle, if you have any follow-up questions to your initial question.
But I don't know, I'm curious, yeah, what, other ways that you all well, that comes to mind for you, how we do that. I'm sure there's a lot of it.
Yeah, I would love to know. I'm thinking about, in particular, the introduction to family therapy course that exists in every master's program, right? Or even
Mhm,
advanced family therapy courses where you go into some of the more contemporary model. There's still a very strong Western centric, white centric, Eurocentric, heteronormative lens on a lot of these models and the research that accompanied these models in earlier decades. So I'm wondering, are you supplementing students' reading? Like, how do you introduce them to that critical examination you talked about?
yeah, so I think the first step is doing a little bit of what you're sharing, which is acknowledging and naming sort of the biases that are inherent in our foundational models. I've taken classes and I've been in conversations with folks who teach these classes where that's not even part of the conversation. It's just this is the model, this is the research on the model, this is why we use the model. So even just examining, hey, where did this model come from? Who created it? Who taught it? How did the where did these what are the basic assumptions underlying it? So we often say, "Oh, yeah, what does this theory think about XYZ or family functioning?" But that came from a place. So let's talk about the place where that came from, right? If there's a normal way for families to operate. So if we think about Minuchin and structural, for example, right? There's a specific structure that exists that promotes healthy development where there's some particular biases in that assumption of the structure. So let's talk about where did those come from? What have people done? So some of it is supplementing how have other people thought about this theory and critiqued it or questioned it? Has it been applied with diverse populations? And if so, how are they engaging it and how are they taking
Hmm.
it into account? But then also some of it, at least for me, is supplementing with other theories that aren't necessarily foundational MFT theories that just offer like a maybe a more expansive way to think about the work that we're doing. We have to learn those foundational models because that's what our tests and exams are
Hmm.
on, and that's how we get licensed. And I think it's important that we really critically examine them. So naming the biases, naming where they come from, and then trying to supplement with work that really good folks in the field have been doing to challenge these theories for a long time. I think of a lot of the work I do with it is with Black families. So I think of Nancy Boyd Franklin and her work on Black families in therapy and like how she outlines all the foundational theories and their approaches and then talks about the limitations. And that's done in a lot of work by lots of other folks too, and for other populations. I think bringing that in helps students be able to say, "Oh, okay, we're not the first person to have these concerns or questions, or we're not the first to not see ourselves in these models. And then what does that mean for our clients who may not see themselves in these models either?"
I'm wondering if you have used the socioculturally attuned family therapy book at all by McDowell and Nathan Martin and Bermudez.
Yeah, I haven't had the opportunity to assign it as the primary text in class, but I use it often like their articles and then supplemental chapters in my class. Teach a diversity and couple and family therapy class, so we talk a lot about social cultural attunement in that class. But I also teach our pre-practicum class before they start seeing clients, and we talk a lot about social cultural attunement in that class. It's been a few years since I've had the privilege to teach like the foundational class. I really like it, but I haven't taught it in probably 3 years now. So I've been pulling some of that in these other classes. And I think that idea of social cultural attunement is really important as a foundation to like, okay, I can choose whatever theory I want to choose, but how can I make sure that it's relevant to the client's needs, that it's
Mhm.
taking into consideration like systemic oppression and the way that might show up, and then really reorienting our relationship to the issues and concerns at play, which can be the theories. I think that's really helpful. So I try to introduce the idea of third order change early
Mm.
so that as they're learning theory and they're learning theory and also just basic skills, they're like, oh, okay, maybe there's more to than just changing the rules or changing the process. We can change the relationship to these institutional structures and systems.
Yeah. I can go down this rabbit hole with you for maybe just a couple of minutes more. I'm wondering, in your pre-practicum class, now the students have had already the foundational courses, right? So you pick them up like maybe midway through their program to go into pre-practicum, right before they go into internship. So I'm wondering, yeah, how are you talking about biases? Are there any activities? Do you make them role play? How do you challenge the unlearning
Mhm.
process?
Yeah, there are activities. I get them in pre-practice. This actually their first semester because our students start practicum right away in their second semester
Oh,
in our
wow. Okay.
2-year program. I've taught in other programs where it's not that quick, but in the current one, it's pretty quick. So we do a lot of all of the above you mentioned. One of the things that we do that I think has really been helpful is the deliberate practice role play on
Mhm.
attention to cultural diversity. So if folks are familiar with like deliberate practice in systemic family therapy. I'm blanking on the names. I know you know the names. Of the
Adrian Blow,
yeah,
yeah,
yeah.
and Ruth Maniera and
Uh-huh.
Vaz, yeah.
Yep. And so we do that activity in pre-practicum and in diversity class where they're giving a vignette and it's asked to respond with attention to diversity. So acknowledge your listening, identify what they share the problem is related to maybe a cultural aspect, and then inquire more. So getting them just willing to say, like, when someone makes a spontaneous statement about their identity, experience, culture, values, you don't just ignore it to move on to what you deem as the most appropriate presenting problem. So we do that role play. I also ask students in pre-practicum, and we continue this on, to engage in two other activities. One is identifying what is it called now? I'm drawing a it's an activity where you identify the source of your name. So all the names you've been given and where they
Wow.
come from and what they mean and the history behind them as a way to introduce yourself to your cohort members, but also to start to be thinking about who you are, where you come from, what that means, and even silly things like why you were named that way. I joke that my mom named me Ashley. She named me after a soap opera character on The Young and Restless that she really liked, but it's also a very white presenting name. So when I'm out in the world and people see my first and last name together, they assume I'm white until they see me and they go, "Oh, okay." So there was some
Interesting.
intentionality behind that name for her because
Okay.
she wanted me to be in the world a little safer, have a little less biases when it came to resumes and interviews and that kind of thing. So just
Wow.
being able to name and acknowledge that early on,
Mm.
or even things like your lineage. Where did your name come from? Is it a family name? What does it mean to you? So that's a helpful way to start getting people to think about, oh, maybe I've never thought about that, or I didn't know this might mean something for a client. And then the other activity I'll mention quickly is the location of self activity, the work of Dr. Thandi D. Wash Jones around really encouraging clinicians to have conversations with their clients early on about their location of self, their identities, their experiences, how they're similar and different, and how that might show up in therapy. So trying to encourage students to develop a sense of comfort and naming their identities and why they might be relevant, and
Mm.
also trying to understand the client's own locations and what that might mean for them. So really trying to encourage these conversations early on that historically, I think our foundational theories would say aren't as important because what does that have to do with the presenting problem?
Yeah.
And so trying to start us off by saying we need to build comfort to talk about who we are and these different things that impact our sense of self. And by doing so, we're offering to the clients the opportunity to say, this is important here. You can talk about this here. And we need to do it for all of our clients, not just our clients who we deem as other, right? So who
Mm,
don't fit the dominant cultural standard. Students will say, oh, I'll do this when I have a person of color or a queer person or a person from this background. It's like everybody we need to talk to about these different
mm.
identities. And so trying to build that willingness and, like, understanding and competence early are a couple things that I do.
Yeah, wonderful. Thank you so much. I love this.
Great job. But I love these that you named, Dr. Hicks. I'm thinking myself of how to do that better in my practice with mainly postgrads, but I do have practicum students and interns. And so I'm like, I love this activity and I'd love to actually do that in my
Yeah.
practice.
Thank you, Danielle. I want to move us along, thinking about piggybacking off of what you just said about the self of the therapist and the person of the therapist approach. I know one of the one of the many aspects that has been colonized in our field is self-disclosure for therapists. And so I'm wondering how Dr. Hicks is approaching self-disclosure in a way that is ethically appropriate, but also not drawing from the colonized approach of you need to be very limited in your self-disclosure. You need to be very careful with your self-disclosure, not too many personal things shared with the client. How do you approach this with the students first, and then how are you modeling or teaching from that perspective as well?
Yeah, I think this is always a good topic to talk about. It comes up all the time. When I think about self-disclosure, one of the things I think about is first this idea that we use self-disclosure for the benefit of the client. So we want to be thinking about what are we sharing, when are we sharing it, and how is it going to be helpful to the client. And so sometimes we use self-disclosure for rapport building. Sometimes we use it to help. We're working on something they're not quite, it's not quite landing, or we're trying to convey something, and we think this self-disclosure could be helpful. And then I think there's this cultural aspect of self-disclosure. Who are you? And that certain clients want to know who you are and that you care and that you understand them. So they're going to ask you questions, and I find that my lots of clients do this from different backgrounds. So when I work with Black clients, when I work with clients of color, when I work with Indigenous folks, when I work with LGBTQ folks, when I work with folks experiencing poverty, they want to know, do you understand me? Do you get me? So they're going to ask you questions. They may share things with you that they might not share. I think I encourage my students to think about self-disclosure as, is it going to be beneficial for the client? And then also just recognizing first and foremost that for some of us, for all of us, there are things we self-disclose by just walking in the room because we show up and people make assumptions. Their assumptions may or may not be correct, but they
Hmm.
make assumptions. There are some things we self-disclose by having it in our background if we're on telehealth or in our offices when people come in to see us. And so I think how can we be intentional about those self-disclosures as well? They're not always verbal, but it's what do you want to communicate about who you are, what you believe, and how you practice by the background in telehealth or by the way your office looks or the way your waiting room is set up or the books that are on your bookshelf. I'll never forget I had a client walk in the office and say, "Oh, you had that Angela Davis poster on your wall, and you had that book, that Michelle Alexander book about mass incarceration on your shelf." And I walked in and I thought, "This is the clinician for me." And I was just like, "Oh, this is just me." I didn't never thought too much about it. I was just like, "This is just who I am." So it's just in there. And they were like, "Oh, I saw that as soon as I walked in." Encouraging students to think broadly about self-disclosure in terms of not just the verbal disclosures, but also, what you wear, how you dress, what you say. I have a Chinese student who specifically wore clothing that was from her culture because she wanted people to know who she was, and that was her way of disclosing. She might say something, she may not, but she had certain clients. So I think it's thinking about it broadly, recognizing that we want to be careful, right? Because we don't want to just make it about us. Like I'm disclosing because it's my time to shine, but that it's okay to be It's okay to be intentional. We don't have
Mhm.
to be so separate from ourselves in this work, I don't think. Obviously, we can't let our stuff bleed onto our clients, but we don't have to be. I think sometimes we folks assume that to be a therapist, you have to present a certain way, and that certain way is the way that like white male professionals are said to show up. So when you show up differently, they're like, "Oh no, get go back in that box. You're not presenting properly." And so I think we can be intentional about how we show up, how we dress, what we share. My
Yeah.
biggest thing is just knowing when you disclose something, you can never take it back. So if you're choosing to disclose your sexual orientation, for example, or if you're choosing to disclose your ethnicity or something about your background, just knowing that you put that out there and you can't, the clients can do with that what they will. You can't take it back. Being intentional, but recognizing that I think relationship building sometimes may ask us to be a little bit more forthcoming, particularly for folks who don't necessarily see themselves as part of the dominant, like therapeutic experience. And that can be okay too.
Yeah. Yeah. I love the idea of self-disclosure on multiple levels. And I also love what you said about self-disclosure being beneficial to the client, like on a case-by-case basis and assessing if sharing something is appropriate. These days, I have a lot of conversations with my students around disclosing struggling as a therapist
Mhm.
and not doing well the day of the session or being crushed
Yeah.
by some news you received, right? And like how
Mhm.
we
Mm.
portraying ourselves as this strong, we got it all together, authority, expert figures, and how it's not like that at all. So I'm wondering, yeah, Danielle, do you have any thoughts around self-disclosure as a form of decolonization? And maybe you can talk to us about how you do that in your own practice.
Yeah, definitely have my wheels turning in a lot of ways. I like what you said first, Dr. Georgia Dube, around like the colonization version of how we're taught, because I was definitely taught to limit your self-disclosure. But I think I was also taught to that there should, like you said, Dr. Hicks, there should be an intention around it. Does it benefit the client? Is it for you? Is it for them?
Yes.
However, we are human, and that's also right, like you said, Dr. Hicks, how you connect, how you build rapport, but you do wanna be careful of what you share, and is it appropriate or not? I even think back to some things, I'm like, I think one common thing that I've always been asked of, especially when I started out, right, and a lot of the clinicians about their age, right? "How are you gonna help me when you're really young?" Or I get this a lot of, I work with children and adolescents, and so I had a lot of parents ask me, do you have children? Can you really help me if," and so, of course, there's times where I do answer. I don't mind answering honestly. So really, that's that clinical judgment that you develop over time.
Yeah. You mentioned that you work a lot with Latinx families, Danielle. I'm wondering, is there anything in particular that you do as a form of like nonverbal self-disclosure to convey to your clients that they're welcome in your practice?
Number one, I work with mainly lower SES, and thankfully, we've been able to build really high quality practice so that you don't always see that. You don't always see all of these various toys and different cultural background toys that are culturally sensitive with different races.
I'm wondering about colonization, and Danielle brought this wonderful question into our discussion for today. Colonization in how it affects the structure of our curriculum on an institutional level. So when certain things are dictated as part of our curriculum by the institution or by accreditation standards or whatnot, that we then have it out of our hands or out of our control to reform or select certain information or to critically examine even information. I'm wondering how you navigate this space of like the colonization of the curriculum within an institution that may be very colonized, right?
Yeah. Yeah, that's a great question. And I'm thinking about it because
Oh.
I've worked at different institutions. I've worked at a private institution, I've worked at a public land grant institution, and they both were accredited programs. So some of that is like the accrediting body, what's required. And I really do think there's certain things we have to teach. And then also to lay another layer onto that is like your state licensure board. Some of our state licensure boards require certain classes to meet their requirements, so you have to teach certain things, and I've encountered that as well. And there's a lot of directive in terms of what's required in order for our students to graduate and get licensure. So I think in some ways there are limitations to that. You have to teach these classes in this order, or you have to teach these things. I'm currently in Ohio, and there's laws on the books around what can you teach and what can't you teach. So there's also at the state government level rules around what's appropriate to talk about and what's not appropriate to talk about. So I've been feeling that a lot lately, actually. I think when it comes down to like how you handle that, I think one as a teacher, I recognize that, okay, this is the box that I'm in. Like I can't get out of this box per se. But I do have some ability and maybe some authority to dictate how that plays out in the classroom. And so I may share with students, these are the things we're required to learn for these standards, for these learning objectives outlined by the program. And so this is what we want you to learn, and this is how we're going to go about learning it. But the process about by which we go about learning it, I have some control over. So then I think I get to play and I get to say, okay, I don't have to teach it in the same standard way that maybe it's always been taught. I can bring in some critique. So a lot of my work is thinking like, how do we help develop critical consciousness and critical examination? So how can we critique this while we're also learning the bare standards of it or the bare bones of it? And then how do we engage what's required for us to learn alongside other things that might help enhance our understanding of this topic beyond just okay, this is what the theory says, or this is what this practice says, or this is the diagnosis, this is this is how you diagnose. These are the criteria. This is the treatment that fits. What happens when that doesn't work? So a lot of my conversations sometimes are like, I'm teaching you the thing, this is what it says. And then what happens when that doesn't fit? What happens when that doesn't work? And that often gives us an opportunity to get curious and to really take a step back from, okay, this may not fit actually. And oh, yeah, there's reasons why we assume it's this way, but then we may not really be thinking about the fact that a lot of some of our foundational stuff really relies on this, like the colonialization. Oh, this is the dominant culture's beliefs and values, or oh, this is seen as right or preferred because of this. And I think it helps too when you bring in I find when I bring in guest speakers or other materials from folks who then they don't have to just hear from me. So it's not just, oh, Dr. Hicks, she's on her soapbox. This is the thing. But that other people are coming in, that other clinicians, other providers, other people from different populations are coming in to share about their experience. So then folks can say, oh, okay, there's like a lived experience to this, not just what we're reading in the text.
Danielle, you have some thoughts around this, and I'm wondering again from your perspective, even asking this question, what was your context of thinking about this? Have you run into similar experiences? Or, yeah, what was the impetus?
Yeah, working with my doctoral internship, I worked with my mentor, Dr. Christy Harrison, and she invited me to her university that I think she's still there. She was like the director of the MFT program, and we created a play therapy course together, and she mentored me through that, and I taught it asynchronously. But I guess that was when I started. That was my first exposure to teaching in an institution, and as I guess as time went on, as I was interviewing other professors to supervise for us, I've been hearing that more and more, I guess, about that at the institutional level, it's almost like bureaucracy, and how that, yeah, things are limited as you're talking about, Dr. Hicks, and to some degree. And I think there is definitely some resistance. How do we balance that? And I don't know if that's a follow-up question. How do we balance that? Because I think of like white privilege, and that I remember that topic being brought up in a course in my master's program. And it was like, what do you do? How do you balance that as a white person? How do we come to a mutual understanding and respect and move forward in a way? And
In thinking about our interactions with students around this topic of decolonization, I suppose there are varying levels of resistance from students. So I'm wondering if we could talk a little bit about broaching these more uncomfortable subjects and how do you go about doing that? I typically tend to create community agreements for my students. And so we have conversations early on about like disagreements or conflict, or what do we do when someone is impacted by something someone else said in the classroom. But I'm wondering, Dr. Hicks, what are your strategies of broaching these topics that we discussed today, like systemic oppression, race, racism? It seems like as soon as the word race comes out of someone's mouth, everybody's pulling back already. They're bracing for impact. What's coming at me? What am I going to hear now? So I see that here in Texas, practicing as a teacher, but I also see and feel the discomfort of the students to even talk about these subjects without a client there, right? No stakes for the most part of having a conversation in the classroom. Yeah, I would love to hear your ways of approaching these uncomfortable topics.
Yeah, similar to you, I engage in community agreement. I think that's really important. So I do this activity, especially I have an entire class where I talk about these issues. And so in that class, I do this activity called setting the groundwork. And essentially it's a community agreement process. So in the first class, I talked to them, I asked them about their comfort level. So a good therapist rating scale, 0 to 10. How comfortable are you talking about these different topics? And so I asked them about their comfort with race, gender, ethnicity, sexuality, sexual orientation, ability, illness, national origin, language. Like there's a series, and then they rate for themselves 0 to 10. They don't have to share their comfort level, but I usually ask for aggregate. Okay, how many folks were between 9 and 10, 6 to 8, that kind of thing, just to get a sense of where we are as a group. And I asked them to reflect on what they notice about their comfort level. So, what are the topics they're most comfortable talking about? What are the ones they're least comfortable talking about? What do they notice about those? Are the ones they're most comfortable talking about, like their own identities or things that they think about regularly? Or is it that they don't have exposure or experience? Like just getting them to reflect in that and think about that. And then I asked them to think, what do you need to be able to feel comfortable or willing to be brave and take risks to talk about these topics that like we know and at least in our society are seen as maybe more taboo topics. So what would help you be comfortable or at least more confident in taking risks to talk about these in this shared space? And then we have a dialogue, and then our agreements are usually co-created by that group of students, and they're able to list things and say things. People can say yay, nay. I draft that list after our first class. I usually have a few things that I absolutely want on there, but 9 times out of 10 they come out anyway. So it's not like I have to put them on there. Every now and then I'll add one or two of my own and just name that as the professor. I'm gonna take this privilege to add these, and how do we feel about those two? And usually they're fine. Usually they're like I statements or asking for what you need, advocating for yourself. So they're nothing too out of the ordinary. And so I draft that, I sent it out in between class, and then the second class we review it and we get to workshop it again. So by the end of the second class, we have a solidified draft we agree on, and we use it throughout the term. And so that's one of my big ways is like this process of creating this shared agreement and really letting it be student led and their voices be heard. I think it also really helps because I've had students say to me, these topics are uncomfortable to talk about in general, but I'm uncomfortable talking about them with you. You're my professor, you may be my supervisor, you may be my advisor, so acknowledging dual relationships. But also, you're a woman of color, like you're a queer person. And so I'm uncomfortable because what if I offend you and you grade me? So I think it has allowed us to have really open conversations that we probably wouldn't have if we didn't go through that process. So that's been really helpful. And I do it with each cohort. So I'm also able to learn from previous cohorts. This has shown up. It may not be mentioned in this cohort, but now I'm going to bring it up just in case someone's here and they don't want to share that thing. And sometimes they like, yeah, that's us. No, that's not us. But it gives opportunity, I think, to check in and build rapport and decide how we want to move forward together. The other thing I do when I'm talking about these things is oftentimes do check-ins. Like, what are your emotional reactions to the material you read? How much did you read? How much did you understand? How did you feel about it? What came up for you? So really trying to like allow folks to engage in some of that like self as a therapist or self-reflective work to say, this is how this is hitting me. So that way, if you read an article for today and it made you angry and you're so angry or you don't buy it, like we just know where we're coming in with and we all have our different positions and that's okay. So I try to help make it transparent or build some transparency and vulnerability in the process. And when folks buy in, I think it works really well.
Yeah, I'm wondering, talk about my white privilege in the class, and I invite all the students to explore what that means for them, especially the white presenting students. I'm wondering if there is any of that white fragility presenting in your classrooms where people are resistant, specifically because you are visibly an educator of color. Does that show up at all? Like the idea that I don't want to present as someone that has racist thoughts or racist stereotypes about people. So I'm going to do my best to stay in the background of all conversations.
I that has, and I've been teaching now, and I've been teaching these topics for the last 9 years. So I have seen it show up in different contexts in different classes for different students, right? This discomfort. I don't want to talk about this with you because I don't want to offend you. I don't want to talk about this with you because I don't agree. And so with maybe your perspective of what you're saying, and so I don't want to show out. I think I'm pretty open. Like we all have our biases. We all have our things where, so I try to model, like I try to share some of my own biases. We do the implicit bias test. So I share my results to say, I have these biases, and this is what this means, and this is how I have to address them. None of us is perfect, and try to like model that openness. So using a little bit of self-disclosure in the classroom space and naming that reality that you may feel uncomfortable if you've never worked with a faculty member of color or you've never talked to someone about these things. Like this might be different for you or new for you. And a lot of times that opens up conversation, but yeah, it happens, and sometimes we can work through it and we learn, and other times folks buckle down and don't really want to work through it, and
I know.
that's okay
We can't
too.
reach everybody.
That's
Yeah.
okay too.
Yeah.
Yeah.
Danielle, do you have any closing thoughts about what Dr. Hicks shared? Any experiences from you as a student and a supervisor as well?
I love the idea of a community agreement. It's a must because the microaggressions happen and we're all human and we all make mistakes. And no matter how much education and experience you have, there's a lot of things we may or may do, hopefully not intentionally, but like taboo topics and things we do. But I think just, yeah, like naming it, like Dr. Hicks said, like what comes up for you? How do you feel? And maybe also like distancing yourself from that idea. Let me talk about it in a kind of third party way. It's there and not make it so personal. So I think that helps, even though it is personal, because I think you can bring the personal stuff into your own individual supervision, your own individual therapy. And some things don't necessarily need to be addressed in a big setting. Some may be more beneficial in one-to-one or smaller settings.
All right, so there you have it, everybody. I want to thank my fantastic guests, Dr. Ashley Hicks and Danielle Barcelo, for sharing their experiences on teaching and learning marriage and family therapy. I hope their wisdom and insights will help you on your own academic career journey. Dr. Hicks, how can listeners interested in your work reach out to you?
You're welcome to reach out. You can always shoot me an email. You can reach me at hicks.266@osu.edu. If you want to reach out to me at OSU, or you can reach out to me at ourlineageourlegacy@gmail.com if you want to reach out to me related to my private practice. And then I'm on Instagram, Dr. Ashley A. Hicks, and it'll link to my website, and you can see stuff I do. And yeah, connect with me there.
Fantastic. Hicks, thank you. Okay, Danielle, how can listeners interested in your work reach out to you?
Yeah, email probably is best at just Danielle@familyfirst.llc. It's just all spelled out. Or our website, our group practice website, www.familyfirst.llc, all spelled out. So no, thank you so much for having me, Dr. Georgia Dew and Dr. Hicks. And this was such an honor to be here. And yeah, just thanks again.
Yeah, absolutely. You're welcome. And thank you for being here. To our listeners, I hope you found today's discussion enlightening and inspiring. If you're hungry for more engaging conversations, be sure to follow our Learning and Teaching Systemic Therapy podcast episodes wherever you listen to your favorite podcasts. We have exciting episodes coming up every month, so stay tuned. Thank you for joining us today. Until next time, keep connecting and learning with colleagues. This is Dr. Sofia Georgiadou signing off for STMFT's learning and teaching systemic therapy.